We always think the next big thing in medicine is going to be some high tech gadget or a miracle drug. But what if it's something simpler? Today, we're diving into this incredible story out of Scotland. It's about how one medical service completely changed the game for their patients, not with new tech, but just well, by listening. And to really get a feel for this, let's start with a patient named Trish. Just listen to what she said. Her experience with this severe photosensitivity just perfectly captures how confusing and, frankly, how lonely these conditions can feel. Her story is the perfect place for us to start.
Okay, so before we get into the solution they came up with, we really have to understand the problem. I mean, what's it actually like for these patients day in and day out? What does it mean to live a life kind of in the shadows?
So the official medical term is photodermatosis. It's basically a catch-all name for a whole group of skin conditions that are either caused by or get way worse with light exposure, usually sunlight. Now, for some people, it's a pretty common thing, but for others, it's super rare. Either way, the impact on their life is huge. And when I say huge, I mean it. Check out this number, 39%. That's how many patients, nearly 4 out of 10, say their condition has a very large negative impact on their quality of life. So we're not talking about a small inconvenience here. This is something that completely changes how you live.
So, what does that look like in real life? Well, imagine having to plan your entire day around the sun. You're constantly looking for shade, you're wearing long sleeves and hats, even on hot days. It's this constant anxiety about just going outside. And maybe the worst part, feeling like your own friends and family don't really get it because to them, you look fine. It's a totally invisible struggle.
Okay, so with all that as the backdrop, some things started to change. A whole new way of thinking started to take hold in Scotland's healthcare system, and it really set the stage for a massive shift in how these patients were treated.
It all kicked off in 2015 with this idea called realistic medicine. And what I love about this is how simple yet revolutionary it is. The whole point was to get doctors to flip the script. Instead of the old doctor knows best approach of asking, "What's the matter with you?" they started asking what matters to you. It's a small change in words, but a huge change in perspective. And this is where the big idea meets the real world. A few years later, in 2019, the Scottish Photobiology Service, let's just call them the SPS, they grabbed onto this realistic medicine idea and just ran with it. They decided, okay, we're going to build a brand new program, and we're going to build it from the ground up, based on what our patients actually tell us they need. But how do you even do that, right? How do you create a space where people will really open up? Well, the way they went about it was just as clever as the idea itself. Get this, for their first step, they didn't hold a meeting in a stuffy hospital room. Nope. They invited patients and staff to an event at the V&A Museum in Dundee. Just by changing the location, taking it out of that clinical setting, they totally changed the vibe. It immediately broke down walls and made it a safe space for people to talk honestly. And this wasn't just a random chat session. They used a really smart framework to guide everything. It's a 4-step thing. First, you discover. You just explore the problem from all angles. Then you define. You zero in on what the real key issues are. After that, you develop solutions together. And finally, you deliver. You actually try them out and see what works. So what came out of all this listening? Honestly, the results were kind of shocking. I mean, can you imagine waiting up to 12 years just to get referred to the right doctor? That's what some people were facing. They also talked about this profound sense of being totally alone after they got diagnosed. And they were desperate for better information, not just for them, but for their families, their bosses, everyone. Okay, so they had the problems laid out bare. The next step was the fun part, coming up with solutions. And the key here is that they didn't do this for the patients, they did it with them. And you're gonna love some of the ideas they co-created. They're so smart and practical. For example, they launched a podcast. It's called the Light Sensitivity Podcast. Patients basically said, we need a better way to explain this to people. So they created a show where patients and consultants could just have real, down-to-earth conversations. How cool is that? And to tackle that insane 12-year waiting time, the solution was brilliant in its simplicity. They created a photosensitivity red flag poster. They sent it out to family doctor offices all over Scotland just to help them spot the signs earlier and get patients referred to a specialist way, way faster. They also thought about the day-to-day grind, school and work.
So patients helped design these little info cards that you could hand to your teacher or your boss. It just clearly explains the condition and suggests some simple adjustments that could make a world of difference. Super practical.
And this part of the story is just my favorite. Two of the patients, who had never met before that event at the museum, they connected and were so inspired that they started their own thing. They founded a peer support group called PELS, which stands for Photosensitive and Living with Sunshine. It's become this incredible, vital network for people.
So you can see all these great ideas came out of it. But did it actually work? What was the real impact? Let's look at the results, because this isn't just a nice story, it's a potential blueprint for healthcare everywhere.
How about this for a result? 94%. For the last 3 years, that's been their patient satisfaction rate, 94%. That's not just a nice to have, that is solid proof that this approach of listening and co-creating flat out works.
But it's not just about the numbers, right? It's about how people feel. And this quote from a patient just says it all. It helps you realize that it is not just you affected. Just that feeling of, I'm not the only one. Man, that's so powerful. It's a huge part of the healing process. And here's another one that hits on the same idea. This person says they really like the updates from the department and chatting to other people with sensitivity to light. See, it comes down to two simple things: communication and connection, feeling like you're in the loop and feeling like you're part of a community. And, people started to notice. This amazing work got formally recognized. The team won a big award from their local health service, specifically celebrating this awesome collaboration between the staff and the patients.
So here's the real kicker. This isn't just a sweet story about one clinic in Scotland. What they've really built is a blueprint. It's a flexible model that any hospital, any clinic, anywhere in the world could use. It proves that you can make massive improvements to patient care just by making a real commitment to listening.
And that brings us right back to where we started. It all leaves you with this one big question to chew on. What if the next huge breakthrough in medicine isn't a new drug at all? What if it's just a conversation?